हेलो, सर वॉइस आ रही है? हेलो, हेलो।
Hello. Yeah.
My friend went to Vietnam. Yeah, उसका नाम
Yes, on है
Hello. Uh, Hello, Hitesh sir. Am I audible to you?
Uh, Yes, yes, Abhilasha,
Yes,
you
sir.
are audible. Am
Sir,
I audible?
yes, sir. Yes, sir. You're audible. So, should we start the session?
Yes, yes, sure.
Yes, yes, sir. Thank you so much, sir, for your time. So,
Thank you.
dear colleagues and dear students, we have today's second speaker for the day, Professor Hitesh Mishra, sir. Sir is from the Department of Pharmacology, IGIMS Patna. And a brief introduction about Sir that Sir is a co PI of ICMR RUMC project, faculty at RCMET, Nodal Officer AMR project NCDC New Delhi, Member Secretary of Hospital Pharmacy Committee. Sir has various international and national publication. Sir is a very dynamic person with having different administrative responsibility. Today, the topic Sir is going to deliver is drug and medical device safety alert. I welcome you, sir, for your talk and for your time. Thank you so much, sir.
Okay.
Over
Thank
to
you,
you, sir.
Abhilasha. Thank you. How could I actually? This is some new interface, and how should shall I? Okay, I will just try to connect this one. How I will share
Ji, sir.
the just. Is this visible?
Yes, sir. Yes, sir. Is it
Or the,
visible, sir? Yes,
it is
sir.
in the slideshow mode.
Yes, sir. No, sir, it is not on a slideshow mode. We are able to see it.
Okay, just give me 1 minute. Stop sharing. And is it now the slides are visible?
Yes, sir. The slides are visible, sir.
Okay. Now is it in the slideshow mode?
Is it? Yes, sir. Yes, sir. Is it? Yes, sir.
Okay, okay. So thank you and thank
Visible,
you,
sir,
Kiran
visible.
madam. Am I audible now?
Yes, sir, audible.
And thank you, Kiran madam. Thank you, Anshuman sir, and the डिपार्टमेंट ऑफ फार्माकोलॉजी एट IMS BHU। और मैं यहीं से वहाँ की काशी की पावन धरती को प्रणाम करता हूँ कि really you people had given me a, you can say, the platform just to interact. Okay, I'm not going in much detail. My topic is somewhat that is related to the pharmacovigilance and drug and medical device safety alerts. So I already, you can say that I presented this topic, I think 3 or 4 times in different, you can say, the places there. Just I am for the today's presentation, I blend it with the this fourth National Pharmacovigilance Week, which is having the theme that is building the ADR reporting culture for patient safety there. Okay, which is started yesterday there. So good afternoon, my dear friends and colleagues there. So now that before presenting, one disclaimer that there is no conflict of interest with any person, society, or organizations. The contents are purely made by me using the different resources as the references, and I acknowledge them. Mm. Okay, so now when we think about the ideas, you will see, you can say, the lot of, you can say, the news on the online or the offline media. Okay, like as it is now there in the screen, one of the 28 Baba hospital patient, okay, they succumbs, okay. So what is coming there in the newspaper is only the serious one, okay. What is not coming are the non-serious ones. So they never comes to the, you can say, the in the headlines there. They never makes the headlines there. So does they are not, you can say, the important to us there. Okay, so this should be in everybody's mind there. Okay, along with this question there, so that all medical products in the market are not as safe as we think. Okay, and the same thing it applies for the medical devices there. Okay, so the medical devices now they are being a lot there, and you can say the medicine is changing rapidly with lot of stents, and then the, you can say, the devices there in the market, and these devices including the software also. Okay, so, but if you see the number of reporting for these medical devices, okay, just the after the launch of the matter vigilance program, it is not the pharmacovigilance, it is a matter vigilance program. Okay, in the 2015, you will find that the within the 4 year of period, okay, we are having the data up to the 2019. Okay, only 1931 medical devices associated adverse event were being reported, okay, in the period of the 4 years there. Okay, nearly about less than 500 you can say the MDAE were reported there. Okay, and these reports are also not by the different colleges or the doctors or the physicians there who are using them. Okay, this is from the these marketing giants there, the pharmaceutical industry there. Okay, so that is the main dilemma that about the ADR reporting of the ADR there. And this, you can say, the article was published in the 2023. We don't have the data, much data since 2019 there about the matter vigilance program there. Okay.
So I think the slides are not moving.
Now is it moving?
No, so you just have to click on the slide
I am
every
clicking
time.
on the I'm clicking on the slides.
Yes.
Is it moving?
No, sir, it is not.
Not moving here. Just
Yes, sir, now it is moving. Yeah, sir.
uh,
So
okay.
just
Okay. This is the actually problem with the online meme. Now, can you see it? The slide?
no, sir, not it.
No, no, not. Is it moving?
So the
Are the
slides are not visible to us.
okay, 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 okay. Just give me. Now visible?
Yes, sir, it is visible and moving also. Yeah.
Okay, now is slideshow? Is it in a slideshow?
Yes, sir. It is. We are
Now it
quite
is
comfortable
moving.
in saying it, sir. Yeah.
Okay, okay. So there is one question that should come in everybody's mind regarding the drug and the medical devices safety there. So every drug or medical device, okay, what we think they are rigorously tested for efficacy and safety before it comes to the market, okay, to be available to the consumers there. So does this mean that the drug and device that is entering the market is absolutely safe? Okay. Are the ADR that we are having from the clinical trial data, okay, are with us, and does we know all the areas that that drug may produce there? And regarding the device, will the device will work as it is supposed to do? Okay. So these are some questions that should be in our mind there. Okay. So then what is the reason why the unknown ADR it occurs there? And if it occurs, then what we will do for them? Okay, so these are the questions that should be in our mind. Okay, so that everybody know that during the clinical trial up to the phase 3 only the you can say the sample population of around the 5,600 people were included in the clinical trial. So suppose an ADR which is supposed to occur in the frequency of 1 is to 50,000 patient, so that there are the chances that that ADR may be missed during the clinical trial, phase 3, phase 1, phase 2. Okay, that you can say the ADR may be going to be missed there. Okay, so that will appear when the drug is now being used in the lakhs of population. So that will appear there. And there are some special populations on which we never do the clinical trial. There are always been excluded, like the children, pregnant women, elderly. So that is also one problem there. Okay. So then what you can say the what we do for them. So we are doing the post marketing surveillance there. Okay, for the drug, there is a phase 4 in which suppose a drug which is considered to be having the low safety margin, for that the active surveillance is going on. And some of the drugs which are not you can say the known to cause or not supposed to cause the this common adverse effect, then for that the passive surveillance is going on. And if we are getting some you can say the reports of the adverse drug reaction, then the regulatory authorities will take the appropriate action. And that appropriate one of that appropriate action is the generation of alerts. Okay, others we will see also. There are others you can say the actions also. Okay, so that is a reason why we have to report the adverse drug reactions there. Okay, then there are certainly the other reasons why we have to report there. So if you go to the web, then you will find okay a lot of the reasons there. One of the common reason is the global burden of the adverse drug reactions. Okay, you can say that it causes the extra morbidity, extra mortality, and extra cost to the patient there. In the as per the European data there, the per hospital admission prevalence for the adverse events, it ranges from the 2.9% to 16.6% to some countries there. Okay, in India, the visit to the emergency department, it you can say the it is nearly about the 6% there due to the adverse drug reactions there. Okay, and again the adverse drug events they increases the hospital stay of the IPD patient by 2 days there. So these are the other reasons that why we have to report. Okay, so with enhanced reporting and the timely action by the regulatory authorities, all these risks, okay, including the monetary cost, we can cut down those things there. Okay, so then the format, how the you can say the how we have to report the adverse drug reaction. So before reporting the adverse drug reaction, we must know what is the adverse drug reaction. Then who can report an adverse drug reaction? Then what information should be included in the ADR report there? And why the reporting of an ADR is important there. Okay. So for the first point, what is an ADR, adverse drug reaction there? Okay. So we will use the most common and widely accepted definition of the WHO, that it is the harmful unintended reactions to medicines that occurs at doses normally used. Now, this is very important. Doses normally used, okay, they are not the high doses. So normally used for treatment are called adverse drug reaction. Okay, there is one more term, and as a student of pharmacology, you will, I think, you may had heard about that is a event, adverse drug event. So, what is the basic, you can say, difference there? So, for the ADR, the causality of that particular reaction is established. That this X ADR is produced by the drug Y, that is being established. But for the event, that causality, that relation is not being established. So event is somewhat a broader term there, okay, than the adverse drug reaction. Okay, where the causality is still being, you can say, the finding out there. Okay. So then the next question, now we know the ADR is there, then who can report there? So all the healthcare professionals, okay, including the doctors, dentists, pharmacists, nurses, their physiotherapists, even the medical lab technologists there, even the OT technicians there, okay, they all can report. Okay, whenever they are going find all those things, they all can report there. Okay, in the suspected ADR reporting form there. And the other is the for the consumers, there is another form, and they also can report there, okay, including the patient. Okay, so they can report it. Then what to report? This is very important there. If you go to the hospital side and then you ask the physician, sir, had you reported this? So there is one question in the mind of the physician. But that is the known ADR. Why I have to report? Okay, that is a non-serious. That is a frequent. Why I have to report? Okay, so I will report only unknown, serious, or the rare ADR. Okay, that will mostly it will come. You can say the as a dialogue from the physician there. Okay, so then you have to tell no, sir. It is any type of ADR. Okay, whether it is known, unknown, serious, non-serious, rare, or frequent, whatever is, if you are finding, just give it to us. There. Okay, and then the reactions, okay, from many type of pharmaceutical product, okay, that may be the from the modern medicine, that may be the ayurvedic, homeopathic, unani, okay, or even the vaccines there. Okay, so then one has to report all those things there. Now the next question in the series, that how and where to report there. Okay, so the three tools are available there, and one will use with the wisdom there. Okay, so remember, you are having the one of the most powerful tool of the century. Okay, that is a smartphone in your in your hand there, so you can use it judiciously. Okay, so just download the app. One can use this app, you can see the application there, to fill the you can see the form there. And again, one can use this helpline there. And then the third is the ADR reporting form, which is being available there, and very easily you can download it from the different websites, including the IPC and the Cityscope. Okay, and then the last one is the ADR monitoring center, and really this is very powerful thing there. Okay, why I'm saying this is very powerful? Because physicians, they don't have the time to do these first three things. Remember, they won't. I won't use the app there. That is one of the common excuse there. Okay, many times this helpline, it is, you can say, they are not answering. Okay, then they will tell how you are supposed, that I will fill that big form there, such large form there. Okay, so just tell them, go to them and just tell them, sir, you just tell us this, you can say, the particular ADR I had seen, we will come and we will fill that ADR form there. You just go through that duly filled form, and then we will, and in the end, you just sign it and we will submit it there. Okay. So that is how you can decrease the burden, overburden. I will prefer the word overburden. So overburdened physicians can be, you can say, that can take the help of few people there. Okay. Then different type of ADR forms are there, and I think all of you being pharmacologists there, you are, you can say, the aware of them. So this is the form that is on the left side. Okay, that is a suspected ADR reporting form for the healthcare professions. So this we are more concerned there. Then due to you can say for the COVID-19, the one form was being released by the IPC there. Then this is for the serious AFI cases, that is adverse event following immunization case notification form there. And on the right side, that is a blue color, it is for the patients there, okay, or the consumers there. तो भोक्ताओं के लिए in the you can find there. Okay, so we are more concerned with the this form on the uh, left side there, and this is the somewhat you can say the magnified version there. And here just remember the name, full name. It is the suspected because the causality has not been established, or you are not sure about the causality there. Okay, so it is a suspected adverse drug reaction reporting form there. And know the version also, it is version 1.4. This is the latest one. Previously 1.1, 1.2, 1.3 versions were there. Okay, so you should use the this latest version, because please be sure there. Okay, and when you go through this form, there are the four you can say the mandatory fields which you have to fill there. Okay, the first and second is that is A and B. The patient information. Here the initials is there. So initial means as my name is Hitesh Mishra, so HM will be there, and I think everybody know about this one. Then the suspected ADR reactions there, event when it started, when it stops there, and then the description of the event there. Okay, so try to write the description in somewhat story type of format. That is the better you can say format. Okay, so if able, or otherwise you can write as you want to write there. Okay, then the third, fourth essential you can say the field there, that is the third is the suspected medications. Okay, here you will write there. Then what one has done after the reactions there, and if any concomitant medical product, okay, including a self medication, herbal remedies was being taken, then that you can say the information should be shared here there. And in the you can say the fourth one is the reporter detail there. Okay, so you can write your name there, sign it there. So these are the four mandatory field there. Okay, now we all know that we can report, now how to report, where to report, all those things are there. Okay, so this question should come in mind, as we are having everything. Still, then why there is under reporting there? Okay, if you go through the you can say the ADR reporting status of the July month. Okay, of the July this year only 2024 there. So there you will find a total of around 15,300 ADR is being reported all over the country there. The highest is from the PGI Chandigarh. Okay, and some only you can say the I will tell you in this that there are 976 ADR monitoring center throughout the India. Okay, you can get this list from the IPC also. So there are 976. Okay, so nearly about 10 or 15 per you can say the per center the ADR is being reported every month, and this is very low data. If you consider the patient footfall in the I think IMS BHU will be per day, it will be more than 5,000. Okay, so the same is here in the IGMS. It is around the more than 5,000 people in the OPDs. They are coming there. Okay, so if you consider about that, the this is the patient footfall, and then the number of the ADR that is being reported by all over the country. Okay, so you will find this data is very less. Okay, so then why there is underreporting? Okay, there should be some you can say the causes there, and I try to search these causes through the you can say the different literatures there, and I found very interesting you can say the systemic review. Okay, from the this Patricia Garcia, where the articles, okay, of you can say the regarding the underreporting of ADR by the healthcare professionals has been reported there. Okay, so there are the three reasons that is being quoted there under the you can say heading like the professional activities, The first reason in the professional activity is the ambition. Okay, many times the physician prefer to publish the ADR as the case report, okay, and or the case series, okay, instead of reporting it to the ADR monitoring center there. Then they are thinking that this is extra work what we are doing, and we should get some financial reimbursement if we are doing this. Okay, then they are also have some fear of the legal aspect there, that they have to, you can say the they may be sue in the court there. So that is one of the reason there. Then the other reasons regarding the knowledge and attitudes there. Okay, the fear, okay, fear that they may, it may harm the patient, it may harm the relationship between them and the patient there. Okay, then complacency is there, that the only well tolerated drug are there in the market. Then the ignorance is there, that the lack of knowledge to recognize the ADR. Okay, then indifference is there कि भाई एक अकेला चना भाड़ नहीं फोड़ सकता, like that, कि they believe that one case could not contribute to medical knowledge there. Then the diffidence is there, that is a lack of confidence and the fear of appearing ridiculous from making a report of ADR, okay, merely just based on the suspicion there. Okay, then there is a feeling of insecurity there, that believe that it is nearly impossible to be certain about a particular drug producing the ADR there. Then the other reasons are the lethargy. Okay, I will report it tomorrow. Okay, or I will just report it after doing this work there. So that lethargy is there. Then the others, some of the others factors is there, lack of feedback. Okay, or the patient has stopped taking the medication there. So then why to report there? Okay, ADR is resolved automatically there. Okay, so all these factors are there. So once we know all these factors, so now we have to think how we can tackle these factors and how we can increase the reporting. Okay, so if you just divide these factors, some of the factors are under your control and some of the factors are beyond your control. So the factors which are under our control, we can improve those factors there. Okay, and again the literature it is telling there, okay, to increase the reporting of ADR, the first is what we are doing at present. Okay, that is a regular training and the education of the medical practitioners. Okay, and just providing them with relevant knowledge regarding the ADR reporting there. Okay, now we are doing it, you can say the, as we are now doing it, it is around 1 year of period. Okay, so it should be somewhat more frequent. Okay, somewhat more frequent, because whenever you are doing some intervention, okay, after that intervention 2 4 दिन लगेगा कि हाँ ये करेंगे करेंगे करेंगे, उसके बाद effect is it starts decreasing. Okay, that is known as tailing effect. Okay, so just to minimize the tailing effect, we have to reinforce. So regular training is, you can say, the necessary. The other is the using of personal relation there. Okay, suppose your friend is there in the, you can say the clinical department, so you can use your that personal relations, so you can discuss them and encourage them. And then through the posters there, put the posters regarding the ADR reporting. This may help the consumers also to report the ADRs there. Okay, then organize the lectures about the ADR reporting, and also make sure that you have trained the healthcare professional regarding the training how to fill the form. Okay, that is one of the biggest burden there, because if you go to the clinical department, even if you also, okay, just filling that form, it is somewhat cumbersome. So you must, you can say the, assure yourself that you had trained the healthcare professional about how to fill the ADR form there. Okay, then also you can use the different online media to text the messages there, okay, to the medical staff on their mobile phones with the reminders there. Okay, and suppose some relevant information you get, so you just share all those, you can say the relevant information with the, with those, you can say the stakeholders there. So these are some of the steps, and also this is not the, you can say the limited step. You can also think and how to increase the ADR reporting there. Okay. Now, once the report is there with the ADR monitoring center, okay, then what happens to that? So that is the PVPI process flow is there, and many of you had already seen this one there. Okay, from the healthcare professional or the consumers, the information it goes to the two stakeholders. One is the AMC, the other is important stakeholder is the pharmaceutical industry, the national health programs there, or the professional bodies through the case series and all. Okay, that information it goes there. Okay, then from the ADR monitoring center, that is the AMC, and from these the pharmaceutical industry, the information goes to the national coordinating center there. Okay, at the IPC Ghaziabad there. Okay, and then this IPC Ghaziabad, it shares the information with the two stakeholders. One is the Uppsala monitoring center, where there is a VG-Flow on the in the VG-Flow software there. Okay, and other is the regulatory authority of the India, that is the CDSCO. Okay, and from the CDSCO, the information in the form of the alerts or any warning, it goes to the stakeholders there. Okay, after some, you can say, the decision, it goes to the stakeholders there. Okay, so what this regulatory authority do? Okay, once they got some information, karte kya hai basically? Okay, so the first important thing is the safety alerts generation. Okay, they you can say the issue the safety alerts. The second is the recall or the withdrawal of the product there. And third is the upgradation of the package insert, and all of you had seen that package insert in, you can say, the nearly in all the medicines that are coming. Okay, it is inside the small leaflet that is coming there. And in case of the drugs, there is the change in the classification from the over-the-counter drugs to the prescription-only drugs, or from the prescription-only drugs to the special prescription drugs there. Okay, so that warning is coming there. Okay, so safety alerts basically, what are they? Okay, so they are triggered by any potential safety problems linked to a medicine or medical devices, including known, new, or coincidental event. Okay, so all these things, okay, will trigger the safety alerts there. Okay, then there is that's, you can say, the safe advice. That safety alert is, you can say, the having the advice on the action to prevent future adverse events and lessen the risk of such events there. Okay. But the safety alert never means that a product is unsafe to be used there. Okay, so that one should keep in mind. And suppose a person is using some drug there, consuming some drug there. Okay, so he should not stop that medicine or the, you can say, stop the use of that medical device. Okay, only active surveillance is advised after the safety alert is being issued there. So these are the safety alerts here. Okay, so the issue of these drug safety alerts, they basically help in the monitoring of the rational use of medicine in public there. Okay, and this is, I think everybody should actually make an emphasis and tell the clinician that reporting the adverse event does not have any legal implications. Okay, so this should be considered posted everywhere, or tell at least कि भई इन कोई इसमें legal implication नहीं, just you have to report, or if you are unable to report, you just tell us, we will fill the form and you just sign it. Okay, after looking at the form there. Okay, then few examples of the drug safety alerts that are issued recently. Okay, like this is the last month one. Okay, just I am enlarging it. For the metronidazole, okay, there's the fixed drug eruption for the treatment of amoebiasis. When it is used for the treatment of amoebiasis, the trichomoniasis or the giardiasis there. Okay, and this is of the July for the vancomycin. Okay, that it produces the dress when it is, you can say, used for the treatment of serious infection due to the gram positive cocci, including the MRSA. Okay, so like this, the alert safety alerts are being issued there. Okay, so and similarly for the medical devices, the safety alerts are being issued like that. This was the 2 years back there for the inhaler of the Cipla supplied by the Cipla there. Okay, that it is delivering improper dose or the medicament is not released. There is a breathing problem, issue with the pipe of the inhaler, dose counter error. Okay, they are not working or the pin is broken. So all these there, and then what is the action? This is also being you can see the written there. Okay, they like the active surveillance on the suspected device, whether is it used at your center or not, and report all the suspected unexpected adverse event after intended use of the device there. So this is for the supply inhaler. The other is for the hemoperfusion cartridge, that is the adsorba, used for the treatment because of the poisoning there. So the use of this cartridge, okay, so it was being recalled due to the because of problem that the particulate matter will be dissolved there in the blood, or will enter into the blood there. Okay, and these particles may produce some potential serious adverse health effects there. Okay, or the consequences there. Then this is for the stent there, and there was the you can say the uh, complaint for the stent dislodgement. So these are being issued there, and this is for the suture, the auto suture circular stapler there. Okay, so here the a staple guide was not attached to the instrument, and it could cause the component to disengage, and if disengaged, could allow the device to transect the tissue without forming the staples there. Okay, so these are the some of the alerts, and again, you can see the examples of some of the alerts. You can find these, you can see the information in the site of the IPC there. So ultimately, the one of you can say the end slide there. So we what the conclusion, what is the take home message there, that we are having a lot of drugs and the medical devices in the market there. Okay, and therefore we should not, you can say the ignore the pharmacovigilance program of India, meterovigilance program of the India. Okay, and we have to report any, you can say the adverse drug event that come across us there. Okay, for the PVPI now the awareness is very much, and you everybody know about this PVPI. But for the MVPI, the ignorance is still there, and which needs to be strengthened there. And then these safety alerts, they serve to intensify the ongoing reporting of adverse events in more targeted way there. And in the last, it is now it is our turn, as we people are now doing there, to emphasize the importance of PVPI and the MVPI there. So, audience, thank you for listening patiently. These are the references, and some of the references are inside the slides also there. So, thank you for listening, and thank you for giving me the opportunity and the platform to be part of you people there. So, thank you, ma'am.
Thank you so much, sir. Am I audible, sir?
Ah, yes, ma'am. Yes, ma'am.
Yes, sir.
Yes, yes.
Thank you so much for your comprehensive talk. Sir, is the MVPI program going on in your center, sir?
MVPI.
Yes, sir. Yes, sir.
Yes, ma'am. Our IMS become, you can say, the one of the MVPI center in the 2021.
Okay, sir. And sir, how is the reporting culture in is the
Ma'am, it
how
is
is
very poor, very poor. One of the problem is that the form is very extensive. Okay, the MDA reporting form is very extensive. It is 4 pages, and you can also not decide, because we are not the technical person. So there also we need some biotechnologist who will decide whether the ADR or the event is related with this device there.
okay, sir. Mm, that's fine. Yes, sir. We have to improve reporting culture in in pharmacovigilance as well as in material vigilance. It is a important thing to report initially.
Yes, 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 yes,
Yes.
ma'am. Yes,
Yes.
ma'am.
So more than 100 participants have joined. Any question from the participant side? Sir
Yes,
is
yes.
here to answer.
I will try to answer.
Yes, yes. Though there are some limitation in the online platform, sir, but we are eager
Yes.
to welcome you in Banaras for the
Ah,
offline talk.
ah,
Ji, ji.
thanks a lot, ma'am. I am eager to come there. Okay.
Okay. Any question from the participant side?
Hello, sir. Am I audible?
Yes,
Yes,
yes.
yes, Deepika, you're
Deepika.
audible.
Deepika, I think so. Eh?
I'm speaking from. A very good afternoon, sir. I'm speaking from Government Medical College, Datia. It's in Madhya Pradesh.
Yes,
I
ma'am.
wanted to ask you, sir. In our institution, we are very much engaged in PVPI, but not yet doing anything regarding MVPI. So, is there any possibility that we can start this reporting regarding the device related adverse reactions in our institute as it has been started in your
Okay, you
what is
just
the thought?
visit that. Am I clear that you want to be your institute to be part of the MVPI?
Right, sir.
Is so you do one thing now. There is a, you can say, numbers are and the contact details are available there in the IPC website there. So you go through them and you just fill those forms there and send it to the this IPC. So if they will found suitable, they will you can say the give you the status of the MDA, that is medical devices. You can say the ADR monitoring center. So they will give you that status there. Okay, but it will take somewhat time there. So you have to be patient there. So you can also converse on, you can say telephonically to them there. Okay, they are very good people. They actually they want to strengthen their you can say the this MVPI services also. So you can contact them.
Yes, Deepika, absolutely. As sir has told that there is at MVPI site, there is intent form is available. And in
Yes,
between, they ask for the intent form to fill from different institute. They ask to fill that intent form that you want to start an MVPI center.
yes, ma'am. Thank you so much, ma'am.
Any other question from the participant side?
I'm very understanding.
Very good afternoon, sir. This is Dr. Abhilasha.
Avrasha, please, please.
Sir, as we just saw that we have very ardent pharmacovigilance program going on in majority of the colleges, and similar if we compare it to material vigilance, it's relatively poorer. As you also state the same thing. What, in your view, can be done to strengthen it more?
For the MVPI.
Yeah, yes, sir. For MBPI, how can we strengthen it at ground level, apart from the form being expensive?
That is one part. Actually, the awareness, the similar thing as we are doing for the PVPI. So you can go it and you have to actually target the departments. Okay, it may be the cardiology, it may be the gastroenterology. Okay, where the stents are being, you can say the under this neurology, neurosurgery, where the stents are and these different devices like the pacemakers, they are being used there. So you actually you have to target those department basically. So the targeting, it will also decrease your workload. You don't have to go for you can say the in each and every department there. You just target the department and you can say the just allow, make some sensitization program there. Okay, you organize some sensitization program there. So like that you can increase, because until unless they are not interested, then all these your effort will go into vain. Okay, you alone cannot increase that much. So you have to tell, and then also you can make a registry of the patient who are having some sort of medical devices, okay, which are being used by them. So you can also ask them regularly there. Okay, you should remain in contact with them. So that is how we can, as a you can say the pharmacologist, how we can increase the reporting of the this medical devices associated adverse event. So these are actually my opinion how we can go for them.
Yes. One more thing I want to add to that in
Thank you so much,
MVPI,
sir.
one more thing is that the detail about the device. Sometimes, as a medical expert, we are not able to identify the details of the device and why it is causing so. This is also one of the thing in the MVPI program. So it should be an
Oh.
integrated program along with the expert from the mechanical side or the device side, along with the medical person. Yes, sir. So, thank you so much, sir, for your time.
Welcome,
Any
ma'am.
other
Sure, ma'am.
questions? Thanks a lot, sir. With this, I pay my gratitude to you to spare the time for us, and it is a very
Thank you, ma'am.
interactive session, sir. Thanks a lot.
Thank you, ma'am. Thank you.
The students which have joined online, we will give an online certificate to them. Kindly on a group, kindly send us the email ID so that we can issue a certificate to you all with your correct name. Thank you so much. Thank you, sir, for joining.